1 in every 3 cancer cases diagnosed is skin cancer. This makes this kind of cancer the commonest worldwide. The melanin deficiency in albino skins heightens their risk of suffering skin cancer. Dr. Fredo Kuku, a medical oncologist at the Uganda Cancer Institute, explains.
And they tend to be affected by these rays from the sun. And if they expose their skin to the sun for a long time, they will then be at a risk of developing this cancer.
The fragile nature of albino skins makes them susceptible to ulcers that could develop into wounds, which, if not attended to, can turn cancerous.
Now, the lesions tend to be slow growing, but some can be aggressive. But the major characteristic is it's ulcerated, it's open wound.
On Tuesday, NTV ran a story of a 52-year-old woman being eaten away by skin cancer. Alaisa Naivida told NTV she had sought treatment at the Uganda Cancer Institute, where doctors disclosed that her cancer was not curable and suggested surgery instead. Naivida had turned down the treatment because of financial constraints and chose to return home to wait for death.
So most of our patients are not well informed about the disease, and they are coming late. And when they come late, the solution the doctor does when the defect is going to be big after the surgery.
Attending to 50 people with albinism. Dr. Okuku acknowledges that a good number of these patients die unattended to in their localities. The good news is that once detected early, skin cancer is one of those cancers that can be treated very easily. However, like the case is with many other cancer patients, albinos too do report late for treatment.
The challenge is the lack of information about this disease among the albinos. We don't have a special program here locally because they are like any other patients that we have.
Mudua Nambozo has spent 3 weeks at the Cancer Institute waiting for treatment for her skin cancer, which is spreading.
And others, when they go there, they tell them, please, we don't have the medication, or sometimes they ask them a lot of money, which they can't even afford to pay.
Albinos want government to give them special attention to help them fight skin cancer that could be dealt with if detected early.
We use a machine that helps to freeze and precancerous those small cells which later develop into skin cancer.
The Cancer Institute recommends that albinos should be sensitized about the sensitivity of their skins, how susceptible they are to skin cancer, and how they can seek treatment as early as possible. Gertrude Tumusime with Query, NTV.